Yeah, so ladies, you're welcome. I just want to say this. Many people often talk about toilet disease in Nigeria. By the way, for those who are watching, this is DOKITA ORI AFEFE in English version because I have some very fantastic young ladies with me, and the curiosity is straightforward. What is toilet disease? Ah, well, toilet disease in medical terminology does not exist. But in Nigeria and where we're broadcasting from, which is Ondo City and other parts of the country, women usually talk of toilet disease. The impression is that they got the disease from when they were using the toilet seat, or there's one we call latrine in Nigeria. In Yoruba, we call it shalanga. Could also call it pit toilet. It's as if something breathes to the peculiarity of the female genitalia, unlike the men that is more compact and enclosed. So, I'm all yours. You are free to ask your questions about this toilet disease.
Okay, sir. So since you said toilet disease is not caused by just maybe from latrine, so what can be the cause of toilet disease?
Well, like I said, there is nothing called toilet disease. Let me try and explain. The female reproductive tract opens up to the outside through the vagina. Now, the vagina is covered by two folds of skin. We call them the labia minor and the labia major. And so for you to access the sensitive part of a woman, you have to open up the minor and major folds. So if somebody is using the toilet and there is no physical contact with whatever is in that toilet bowl, you can't talk of toilet disease. But women talk about it as if it is a disease on its own. That's how they talk about it. However, when we look at women, we doctors often interpret toilet disease to mean either pelvic inflammatory disease or urinary tract infection. So when a woman talks of toilet disease to a doctor, those are the two things that come to our mind. We don't try to debunk it, we don't try to take their minds off it, then we try to look for that. We can ask questions like, are you having that discharge from your sensitive part? The moment they say yes, then we ask the question, what's the color of that discharge? Is it yellow? Is it brownish? Is it milky? Is it transparent? Normally, the woman's discharge from the sensitive area should be transparent, like the white part of an egg before it is fried or boiled. It should be clear. But when it begins to assume color, then we begin to think there's a foreign body invading that area of that woman. Then we can also ask about the color of the menstrual flow. If it is blackish, then we are worried. If it is bright red, then we say this is not likely to be toilet disease. Okay, I think we're going to pause a bit now. Let's take a pause and see what happens. Okay, welcome back everybody. Yeah, so before we went on that break, we're talking about the symptoms of pelvic inflammatory disease. So some of these ladies may have lower abdominal pain, around the area of the bladder. Some of them may also have irregular menses, and then more importantly, foul smelling discharge from the sensitive area. So some of them again may feel like the pelvic area is heavy, Now, it looks a lot like urinary tract infection because of their close association in terms of location. If you remember biology, or well, if you went to higher school like nursing school or med school, then you realize that the bladder lies in front of the uterus, and the opening of the bladder to the outside of the body, which we call the urethra, lies in front of the cervix. So, and both of them open up into the same area, you know. The urethra opens above the vagina. So if there were to be any infection involving the urinary tract, it can affect the vagina area and vice versa. And if you notice what I said earlier, if somebody were to have pelvic inflammatory disease, it will have lower abdominal pain. And that also is the location of the urinary bladder. So if somebody were to have urinary tract infection, it can manifest or masquerade as pelvic inflammatory disease. Yeah.
So, sir, how can this be prevented and cured?
Thank you. Now, for women, women that go to use the toilet, there's something I forgot to mention. I talked about the urethra in front, the opening of the urethra in front, and then followed by the vagina. There's another important opening, and that's called the anus, which is behind the vagina. So, if a woman goes to use the toilet, she must clean backward. 2, a woman goes to use the public toilet, please use tissue paper to clean up and clean backwards. As much as possible, try not to use water. That's common in Nigeria, but try not to use water in a public toilet. Because sometimes, even though we doctors don't believe in anything called, what do you call it the other time? Toilet disease. When you are using water to clean up in a public toilet, that you know, not everybody uses the public toilet very well. You know, you might transmit, in theory, some organisms to yourself, because water conducts or carries these organisms. Then, as much as possible, a woman that wants to use a public toilet, you have to go with tissue paper and swipes. Isn't that what you call it? Yes. Like this that contains alcohol. Is it wipes or wipes? So you go with your tissue paper and or wipes. You got to wipe the toilet seat. Maybe one day we'll talk about how to use the toilet seat for men. You know, the toilet seat has a cover. When men want to use the toilet seat, they should lift it up. Because when men use the toilet seat, our urine can touch the seat, that ceramic. But that plastic cover should actually be lifted up when men are. But how many men in Africa, maybe abroad, they care? Even abroad, not all of them care, you know. So men generally are not as hygienic as women, and we don't. The way we are brought up. So generally men should lift it up, but we don't. So you clean the seat, and then when you are using the toilet seat, I often advise our women, throw some tissue paper inside first, so that when your stool is landing inside the toilet water, it won't splash on you. So it is that splashing on the body that gives women that impression that they are catching the infection, in quote, from the toilet. But like I said earlier, the sensitive area of a woman is protected by those two folds, the labia minor and the labia major. Those skin folds won't allow anything pass through. But again, psychologically, women think it passes through. So for me, I just tell women, if you must use the toilet, that is in the public domain, do two things. Clean the seat if you must sit on it, and then throw some tissue paper inside. The other thing I also tell them to do is flush before you use, so that whatever you think might be there, you have at least flushed it away. Even if your stool is going to land in that water, it will be your stool landing in a new clean water. You understand? But if that toilet cannot be flushed, I wish you good luck as a woman. Then for urinary tract infection, the urethra of women are so short, just 4 centimeters. So if a woman is cleaning her body, whether at home now or in public, clean backwards. Because if you clean forward, you are going to introduce these organisms into your sensitive area as a woman or into your urethra. And those bacteria can quickly swim up and infect the urinary bladder. Then women should not keep urine in their bladder. Women should empty their bladder regularly. Then we don't encourage women to, use sanitary pads that have been used, or rag, or old cloth, or tissue paper. And there are different kinds of sanitary pads in Nigeria. The economical and the more medicated ones. The economical ones are the ones we use when a woman is put into bed. Those white ones. You don't use that when menstruating. They are not sterile. But you want to use sterile sanitary pads. And you see those sterile, they are also medicated to make sure that whatever is coming from outside can be killed inside that sanitary pad. And those sanitary pads are also, they have filters that keep unwanted organisms from penetrating, and so on and so on. Then women generally, we don't want them to use their fingers to dip it into their sensitive area. We don't want you to use soap and water to clean your body. We want you to use ordinary water. Some even go as far as using chlorhexidine. In Nigeria, there is one commonly called Savlon. It's dangerous. As much as possible, simple, tepid water is enough to clear out whatever is in the sensitive area of a woman. All right. So, can we say you are satisfied regarding this? So, in summary, ladies and gentlemen, those watching us online, if you're in Nigeria or you're a Nigerian, or you've been hearing about toilet disease, to doctors, there is nothing called toilet disease. But we don't discard anybody's complaints or observation, but we try as much as possible to reason it out and find, the best way to, take care of the worries of people. You've been listening to DOKITA ORI AFEFE, broadcasting live from Ondo City, Ondo State, Nigeria. In case you'd like to contact us, maybe you have questions or you want to contribute to this matter, just send a message to us on Facebook, DOKITA ORI AFEFE. You can go to our messenger arm and do that. You can also send a message to us on 081 3564 1399. Again, 081 3564 1399. If you are outside Nigeria, our code is +234. Then you type 81 3564 1399. You can also reach us on our email, kmkc.nigeria@gmail.com. Basically, if you are in Ondo State or in Nigeria and you want to visit us in our office, just come straight to Katharina Medical and Kidney Center, Road 12, Fumbifago Estate, Ondo City, Nigeria. Till we meet again in another episode, stay healthy. God bless you.